Droopy eyelids, medically known as ptosis, refer to the condition where the upper eyelids droop lower than its normal position. This can affect one or both eyes and may vary in severity. Let's know the causes of droopy eyes. Hello and welcome back. I'm Adria, your health and nutrition coach, transforming life naturally. Let's know the causes of droopy eyes. Age. As you age, the muscles that lift the eyelid, levator muscle, can weaken or stretch, leading to droopiness. Loss of elasticity in the skin and redistribution of fat can cause the lids to sag. Second is neurological causes. Nerve damage. Damage to the nerve, cranial nerve 3, can impair the levator muscle, or autoimmune conditions that causes muscle weakness, including the muscles that lift the eyelids. Conditions affecting the sympathetic nervous system, leading to ptosis, along with a constricted pupil and reduced sweating on one side of the face. Stroke can result in nerve damage or weakness in the eyelid muscle. Trauma or injury, direct injury to the eyelid or surrounding area. Post-surgical complications from procedures involving the eyes or head. Congenital causes present at birth due to underdeveloped levator muscles. Mechanical causes, tumors or growths, masses on or near the eyelid may weigh down. Swelling, allergies, infections or inflammations can temporarily droop the eyelid. Systemic conditions like diabetes can lead to nerve damage affecting the eyelid. Thyroid disorders, conditions like Graves' disease, can cause changes in eyelids position. Temporary causes, fatigue or exhaustion, can make eyelids appear droopy. Medications, side effects from certain drugs such as sedatives or muscle relaxants. Let's see how can we prevent droopy eyelids. While some causes of droopy eyelids are unavoidable, such as aging or congenital factors, there are steps you can take to reduce the severity of droopy eyelids, particularly if they are due to lifestyle or preventable factors. Maintain eye and skin health. Hydrate your skin. Use moisturizer or non-comedogenic oil to keep the skin around the eyes firm and supple. Use sunscreen to protect your eyelids and surrounding skin from UV damage, which can weaken collagen and elasticity. Avoid smoking, or as smoking accelerates skin aging and contributes to sagging skin, including around the eye. Adopt healthy lifestyle habits. Stay hydrated, drink enough water. It helps maintain skin elasticity. Eat a balanced diet. Include foods rich in antioxidants, vitamin C, E and omega-3 fatty acids to support the skin. Exercise regularly. Physical activities improve circulation and overall muscle tone, which can help delay signs of age. Protect your eyes. Limit screen time, as excessive use of screen can strain your eyes and contribute to fatigue, making eyelids appear droopier. Wear sunglasses to protect your eyes from harmful UV rays, which can cause skin damage and sagging. Avoid rubbing your eyes, as rubbing can stretch the delicate skin of the eyelid and weaken the muscles. Perform eye exercises. Some exercises may help tone the muscles around the eyes. Blinking. Blink rapidly for 20 to 30 seconds to strengthen the muscles. Apply resistance by gently pressing on your eyelid while trying to open your eyes to engage the levator muscle. Manage underlying health conditions. Control chronic conditions such as managing diabetes, thyroid disorders, or other health issues that could affect nerve or muscle functions. I have a full video dedicated to hypothyroidism and hyperthyroidism, where I have spoken about how you can control and maintain thyroid health. Do check it out. Address allergies promptly by treating allergies to prevent swelling and irritation that can weaken eyelid skin. Cure through eye yoga exercise or eye massage. Eye yoga exercises and massage can help improve the appearance of droopy eyelids, particularly if the cause is muscle weakness, fatigue, or mild sagging due to aging. While these methods are unlikely to completely cure ptosis, severe ptosis caused by structural or neurological issues, they may provide some benefits in toning the muscles around the eyes and improving circulation. Let's see what are the eye exercises for droopy eyelids. These exercises aim to strengthen the levator muscles, which lift the eyelids and improve the overall tone of the area. Blinking exercises. Sit comfortably and close your eyes tightly for 2 to 3 seconds. Open your eyes wide and focus on an object in the distance. Repeat 10 to 15 times to activate and strengthen the eyelid muscle. So place your fingers gently on your eyelids While trying to close your eyes, provide slight resistance with your fingers as you open your eyes. Perform 10 repetitions, holding each one open position for 3 to 5 seconds. Eye roll exercise. Roll your eyes in circular motion clockwise for 10 seconds. Reverse the direction and roll counterclockwise for another 10 seconds. Repeat 3 times. This helps improve blood flow and reduce strain. Focus shifting exercise. Hold an object like a pen at arm's length and focus. Slowly move the object closer to your face, keeping your focus steady. Repeat 10 times to enhance eye muscle coordination. Sit in a relaxed position and look upward without tilting your head. Hold the upward gaze for 5 seconds and then relax. Repeat 10 to 15 times to engage the upper eyelid muscles. Blood circulation, relieve tension and stimulate the muscles around the eyes. Use your fingertips to gently massage the upper eyelid in circular motion. For droopy eyelids, massages can improve blood circulation, relieve tension and stimulate the muscles around the eye. Start from the inner corner of your eyes and move outward. Do this 1 to 2 minutes. Apply light pressure. Acupressure points identify the brow bone point just below your eyebrows, near the bridge of your nose. Gently press the area for 10 seconds, then repeat 5 times to relax and stimulate the eyelid muscles. Gently stroke outward along the lower eyelid to the outer corner. Repeat the motion along the upper eyelid. Do this for 1 to 2 minutes. Tapping massage. Use your fingertips to lightly tap around the eye area in a circular pattern. This stimulates circulation and can reduce puffiness or sagging. Bonus tip: for best results, perform these exercises and massages daily for 4 to 5 times a week. Clean your hands and face before starting to avoid irritation. Use a light eye cream serum during massage to reduce friction. Pair these routines with proper hydration, a balanced diet, and adequate sleep. That was it, guys. I thank you all for supporting. If you love the video, hit like and subscribe to this channel. I appreciate you all.